Hi, my name is Dan, and today I'm going to be talking about therapy in the treatment of depression. Therapy can be traced back thousands of years to ancient Greece, but it mainly became common in a treatment for mental illnesses in the 1800s with Sigmund Freud. There were some other big names like Jung and Carl Rogers who advanced therapy, and by the 1960s, there were over 60 different types of therapy that were in use. And another part of information is that a 2004 survey indicated that 14% of people in the United States had been to therapy in the past 2 years. So not only does therapy have a lot of history behind it, it's starting to become more common, and it seems like it's starting to be a less stigmatized treatment as well. One of the hardest parts of thinking about therapy is where to start. I've found the website Psychology Today is a great resource to getting started because you can go on the website and you can filter to find a therapist with a lot of different filters. So you can put in what age you are, what age range you're in, if you're looking for a specific mental illness. So if you want treatment for depression or substance abuse or anxiety, you can click those filters. If you're looking for a therapist in a certain neighborhood or a certain area, you can put in location filters as well. So it really helps narrow down from hundreds or thousands of therapists to a more reasonable number to look at. At that point, what the best thing to do is then click through some of the therapists and read their bios. So you can learn a little bit about the therapist through what they wrote about themselves, what they wrote their specialty is, where they wrote their training is. And then another good way to help narrow down what you want is by training. So do you want a social worker therapist or a psychologist or a psychiatrist who's also a medical doctor? So there's all these different factors that you can kind of just think through and read through and see what the best therapist for you would be. Another aspect that some therapists offer is kind of like a get to know each other session. So some therapists will offer like a half session for no cost, and you just go and meet the therapist and see if it would be someone that you would want to work with. And if you don't seem to get along or communicate that well, then maybe try another therapist. So there's all these tools to help narrow down your search and find a therapist that could be helpful for you. If you're still a little worried about therapy, I also found a show, it's on HBO, but I've found it on Amazon Prime as well, called In Treatment. So it is a fictional show, but it is a fairly realistic representation of what therapy looks like. So you can watch a few episodes of the show and get a fictional but reasonable representation of what therapy would be like. It can be a daunting task to go to therapy, and when I recommend therapy to patients, I often get a little more pushback than I do for other recommendations like medications. And I understand that. So therapy can be more expensive depending on what type of insurance you have or if you don't have insurance. Therapy takes a lot of time, so a session is usually about an hour long, whereas the time cost of taking a medication is a second or two as you take the medication. And the effort that goes into therapy. So you can't just go and show up for that hour and not do anything. You have to talk and explore some issues and work to get that benefit. But then one of the things that I utilize to help convince people is the numbers behind how effective therapy can be. One trial that I was reading compared fluoxetine, so an SSRI FDA-approved medication, to therapy, and then a combination of both therapy and fluoxetine. And they utilized the Beck Depression Inventory Scale, and the numbers that they found were pretty interesting. So in the combination group and in the therapy group, the scores decreased by an average of 22 points. In the fluoxetine alone group, their depression scores decreased by an average of 12 points. So they were showing almost a doubling of the score by adding therapy into the medication. Next, I wanted to look at a meta-analysis. So a meta-analysis is a conglomerate of a bunch of other trials that they include just in one trial. So it makes learning a bulk of information pretty easily because it's boiled down to one study. So the meta-analysis that I looked at was a conglomerate of 52 trials with psychotherapy for depression, and they found an overall effect size that was moderately large, which is pretty good, and they found that the effects could last up to 2 years after treatment, so which is really good. And then they found that the effects of therapy can be independent of the effects of medication. So even if someone has some improvement on medication, adding therapy can provide additional benefit because it's working elsewhere or working in a different way. My experience with therapy was when I lived back in Denver. I worked in a hospital that had a PTSD inpatient unit. And I was trained on a type of therapy called CPT, which is cognitive processing therapy. And it was similar to an exposure-based type of therapy. And the benefits that I saw in these patients with PTSD was enormous. So what we would do was I sat with the therapist and the 4 veterans, so it was a group type of therapy. The first session, they would read their impact statements. So the impact statement is what they think their PTSD is mostly attributed to. And the first day when the vets would read the impact statement, it was scary to be in the room. Like there was a lot of adrenaline flowing, there was a lot of emotions, and you could tell that their impact statements were truly affecting their mental health. And I know that this is a little different than depression, but a lot of the vets that had PTSD also had depression. And then as we progressed through the weeks and weeks of therapy, by the end class, we had the vets read the impact statement again, and you could tell that their mind was trained to not have that adrenaline release like when they first read the impact statement. So the vets on the last class again read the impact statement, and that charge behind it was lessened, was dampened. And you could tell that the vets were doing so much better in other areas. So I've seen the benefit that therapy can have on mental illness. And I know I'm extrapolating a little from PTSD to depression, but based on the evidence that I read, I know that it can be effective for depression as well. So I hope this brief overview of therapy in the treatment of depression was helpful information. Thank you.